Hi everyone, welcome back to my YouTube channel. Today's talk is on Medicare Final Rule on Graduate Medical Education, Organ Procurement, and Section 1115 Waiver Days for fiscal year 2022. Let's jump right into it. On December 17th of 2021, the Centers for Medicare and Medicaid Services or CMS issued a final rule with comment period to implement the legislative changes to Medicare Direct Graduate Medical Education or DGME and Indirect Medical Education or IME payments to teaching hospitals that were contained in sections 126, 127, and 131 of the Consolidated Appropriations Act of 2021, which is Public Law number 116260. In addition, this final rule with comment period solicits comments on the following issues to inform potential future rulemaking. How to account for healthcare provided outside of a health professional shortage area or HPSA to HPSA residents and feasible alternatives to health professional shortage area or HPSA scores as a proxy for health disparities in the prioritization of additional full-time equivalent or FTE cap slots and the review process to determine eligibility for per resident amount or PRA or FTE cap resets in situations where a hospital disagrees with the information on cost reports that are no longer within the 3-year reopening period. This final rule also addresses organ acquisition payment policies through changes, clarifications, and codifications relative to organ procurement organizations or OPOs, transplant hospitals, and donor community hospitals. CMS is not finalizing the proposed policy for counting organs for purposes of determining Medicare share of organ acquisition costs for organs transplanted into Medicare beneficiaries at this time to further consider issues raised in public comments. Closing gaps in health equity in graduate medical education or GME. This final rule with comment period advances key priorities to close healthcare equity gaps and enhance the healthcare workforce in rural and underserved communities. The training and retention of physicians is critical to ensuring access to healthcare in underserved communities that have historically experienced workforce challenges. Section 126 of the Consolidated Appropriations Act or CAA of 2021 requires the distribution of an additional 1,000 new Medicare-funded medical residency positions to help train physicians phased in at no more than 200 slots per year beginning in fiscal year 2023. CMS estimates that this additional funding will total approximately $1.8 billion from fiscal year 2023 through fiscal year 2031. CMS is prioritizing applications from qualifying hospitals that serve geographic areas and underserved populations with the greatest need. The final rule with comment period also makes additional strides to close the health equity gap in rural communities, which tend to experience healthcare workforce shortages. CMS is implementing Section 127 of the Consolidated Appropriations Act, promoting rural hospital GME funding opportunity, which allows rural teaching hospitals participating in an accredited rural training track or RTT to receive increases to their FTE caps. CMS is also implementing Section 131 of the Consolidated Appropriations Act, Medicare GME treatment of hospitals establishing new medical residency training programs after hosting medical resident rotators for short durations in the past. Some hospitals inadvertently limited their ability to receive Medicare funding for residents in a new training program by accepting residents that rotated to the hospital from other training programs in past years. The final rule will restore that ability to qualifying hospitals that begin a new medical residency training program within the first 5 years after enactment. Section 131 advances health equity by allowing these hospitals, often serving underserved communities, to receive additional residency positions and increased per resident amount or PRAs. Supporting organ procurement and organ transplantation. In the fiscal year 2022, Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System proposed rule, CMS proposed changes pertaining to Medicare share of organ acquisition cost for organs transplanted into Medicare beneficiaries, changes pertaining to charges for services provided to cadaveric organ donors by donor community hospitals, and changes to long-standing Medicare organ acquisition payment policies. In the fiscal year 2022 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule Part 1, CMS stated that due to the number and nature of the comments that they received on the organ acquisition payment policy proposals, they will address public comments associated with these issues in future rulemaking. After further consideration of the concerns raised by commenters, CMS has decided not to finalize the proposed policy with respect to counting organs at this time and may consider it in future rulemaking. CMS is finalizing the proposed policy with modification requiring donor community hospitals and transplant hospitals to bill organ procurement organizations or OPOs the lesser of customary charges that are reduced to cost or negotiated rates in line with Medicare reasonable cost principles. This final rule with comment also codifies and clarifies certain organ acquisition payment policies relative to definitions, standard acquisition charges, Medicare coverage of living donor complications, Medicare as a secondary payer for organ acquisitions, and kidney payer donations. Treatment of certain Medicaid Section 1115 demonstration for Medicare Disproportionate Share Hospital or DSH payments. In the fiscal year 2022 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System proposed rule, CMS proposed revisions to the regulation relating to the treatment of Section 1115 waiver days for purposes of the Disproportionate Share Hospital or DSH adjustment. In the fiscal year 2022 Inpatient Prospective Payment System / Long-Term Care Hospital Prospective Payment System Final Rule, CMS stated that due to the number and nature of the comments that they received on their proposal, they intended to address the public comments in a separate document. CMS thanks commenters for their input on the proposal. After further consideration of the issue, CMS decided not to move forward with the current proposal. CMS expects to revisit the issue of Section 1115 waiver days in future rulemaking, and they encourage stakeholders to review any future proposal on this issue and to submit comments at that time. This is the end of my presentation. Hope you found some value in this video. If you enjoyed it, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.